Welcome, Cal Health Agent clients, to the 2026 Open Enrollment Preparation video. I'm Karen Mariner,
I'm Lucy Mariner.
and we're going to get started right away. Okay, here we go. 2026 Covered California Open Enrollment Updates. It's here. Well, here's what you need to know. You need to know that $2.5 billion in federal funds is expiring. Unless they change something in the next couple of weeks, this is what we're expecting. So federal and state subsidy availability is shrinking, and everybody's premiums are going to go up. Depending on your income for next year, we'll work with you and check that out. State premiums overall in California are up 10.3%, and in Contra Costa specifically, 7.7%. Aetna is exiting the individual market nationwide. They made a determination that it was not profitable enough for them. And lastly, there are plan design changes and deductibles and copays and such that we want to bring your attention to. First of all, quickly, the government policy changes. The federal big brutal bill removed a lot of money from the Affordable Care Act, and specifically monies that were added in the Inflation Reduction Act that President Biden signed in 2021. So those of you who have been taking advantage of the EPTC monies have gotten letters from Covered California about these monies most likely expiring. The Silver 73, which many of our clients have been enjoying this year, is not going to be offered to everybody on Covered California anymore, only to people who are eligible for the plan based on their income projection. And there's going to be a surcharge on the Silver 70 plans through Covered California that we're going to talk about and explain to you if you need to take action. And lastly, there are going to be some stricter documentation rules that will also help you, navigate so that you don't miss any deadlines.
So, if those of you who are on Aetna right now, you've probably heard that Aetna is leaving the individual market. So, for next year, we'd like to come up with a plan for you. This means please book an appointment with us as soon as possible, starting October 15th. This is when we will have the premiums available to you for 2026. For those of you who use the John Muir Medical Group, we will likely put you on Blue Shield, and we will discuss those of you who are not with John Muir, and we'll get you all settled. But for now, just book an appointment when you can. So there are the enhanced premium tax credits expiring that Karen talked about earlier. And this means that we will be returning to the original ACA income limits. So this varies by household size and by modified adjusted gross income. And they are very strict with those income brackets. If you are $1 above 200, 250%, 400% of the federal poverty level, you will not be offered the below silver plan. So definitely more strict brackets. Karen can explain.
So the way that we read this table, I know it's a really busy slide, and I'm going to suggest that you listen to the description and then pause the video so you can find out where your income fits. This is a 2024 table. We have not gotten the 2025 table, so the numbers will be slightly higher across the board. First of all, figure out where your family, which row is appropriate for your family. This is the number of people that are on your tax return, not necessarily the number of people that are getting coverage. So it could be, yourself, your spouse, one of your kids, both of your kids, a parent, however many belly buttons are on your tax return. This is what matters on this chart and to cover California. So we'll sort of keep our attention on a single person for now, just for convenience. So this column shows you what the lowest level of income, and this is projected income for 2026, that keeps you off of Medi-Cal. So that's 138% for adults For the single person, you can see that's 20,783. That's the lowest projected income for 2026 to clear the Medi-Cal threshold. And going all the way up to the highest for that single person at this point, 60,240. You can kind of expect these numbers to inch up a bit when we get the new table later this month. This section shows you how Covered California determines which silver plan you are offered. These three that are in this box, 94, 87, 73, are called enhanced silver plans, and they are income dependent based on your income projection. So this year, what Lucy was just saying was everybody who was subsidized was offered the silver 73. That was new this year. And we're going back in time now to where only people within 30,120 to 37,650 are offered the 73. And the same thing with the 87 and 94. So 94 is this bracket and 87 is this bracket. So stop the video and find where your family might fall so you can, keep yourself educated.
So there will be some plan changes for both the bronze and silver plans. This is both the bronze high deductible health plan and the bronze 60. The IRS made a new rule that all bronze plans are now HSA compliant. Also, the bronze plan is going back to a limit of 3 office visits per person per year, not including preventative. And then also the copays and deductibles will be increasing slightly for 2026. Okay, so for the silver plans, we talked a little bit about them, but there will be a reinstated deductible for inpatient and maternity care, specifically for the silver 73 that did not have a deductible for inpatient or maternity care this year. We are going back to it, and you will have a deductible for 2026. Again, and the copays will be increasing slightly, like the bronze plans. And for the silver 70 surcharge, for unsubsidized folks, if you are one of those families that can see for 2026 that you were offered subsidy, but then you will not be offered subsidy for 2026, please reach out to us so we can determine your next steps if you're offered the silver 70. We want to avoid the surcharge as much as possible. So please book an appointment with us so we can get you off of Covered California and on the exchange if you want to keep your silver plan. And then lastly, the silver 73, like we were just pointing out, will only be offered to people with households between 200 and 250% of the federal poverty level.
I'm just going to add that if you determine, and we're going to show you how to determine this, that your family is not going to be eligible for a subsidy next year, and you want to be on a silver plan, then you need to get in touch with us because we need to move you off exchange to avoid a 12 to 14% surcharge. Here is another very busy chart. So we want to show you a couple of the things that are changing. First of all, Lucy said that we're going back to 3 office visits per year in addition to your preventive. That's on the bronze 60 plan. And so that's just going back in time a little bit. The deductibles and out-of-pocket maximums are shifting upward like everything else a little bit. And here they are in the red box. And so that might be a slide also you want to pause. And then our timeline, what we want to let you know about is beginning October 15th, Covered California is going to start mailing notices about your renewal specifically. They don't do everybody at once. They kind of roll through the 2 million people. So watch your mail, whether it's email or it's snail mail. I know you get a lot of mail, but please watch and open, make a stack and then decide on a day when you're just going to sit down, you're going to look at all the mail from Covered California. We don't want you to miss anything. On October 15th, also, the Shop and Compare tool, we're going to go over that with you in a minute, will be updated with 2026 subsidy results and premiums. And then November 1 is when sort of official open enrollment begins. And December 15th is what we're being told right now, the last day to change your plan for a January 1st effective date. So I'm going to go to the Covered California website. So the first thing to do, take it over, Lou.
Okay, so you guys are going to navigate to the coveredca.com website to use the Shop and Compare tool. There are lots of places for you to click the Shop and Compare button, but the easiest one is in the top right corner. So we click the Shop and Compare tool, and it takes you to where you can fill in all of your family's information. So make sure, first things first, that the coverage year is at 2026. Okay, this will be updated about mid-October. So you'll be able to see your premium estimates. Type in your zip code. We will use 94596. And for our total household income, we will use 40,000 for the year. And we will do one person with age 30 years old. And so if there's multiple people in your family and they don't need cover, if some of them don't need coverage, please make sure to say all of the members of your family like this. Okay, and you can click the needs coverage button if they do not need coverage. So just demonstrating that, but we'll go back to the one person, age 30, who does need coverage. Then you're going to click see my results, click continue, and then you're going to go to preview plans and skip each of these pages. So we'll go down, hit next again. And then you will see on the top that it says, by using Covered California, you save $470.44 a month on your health plan. So that is how much subsidy you are offered a month to go towards your health plan. So the numbers that you are seeing on the Shop and Compare tool is the net premium of each plan. So on the side, you can use filters if you're looking for a bronze, silver, or gold or platinum plan. They also have insurance companies and network types that you can filter with. And if you click on choose plan, it will show you the, I'll just ignore that. Sure. So it's going to show you the different plan offerings. Let's see, change plan details. Then when you click plan details, you'll get to the premium, deductible, out-of-pocket max, and some of the other co-pays and things like that. So the Shop and Compare tool is a really great way for you guys to have some agency in determining whether or not you have subsidy eligibility. So we really encourage you to use the Shop and Compare tool. And we will be sending out the link with our email with this video. Do you have anything to add?
Nope. Great job.
Okay.
What to expect from us. First of all, we will make sure that if you are actively enrolled on November 1, let's say, we will make sure that you are renewed. That's a guarantee, just like every year that we've worked together. We can see the writing on the wall here. There are limited hours for us to talk to clients. That's why we're making this video. So if you know that you need to move off exchange because you're going to be subject to that yucky surcharge that we're so concerned about, please book an appointment early. Lucy and I will both be available to help you. But beginning October 15th, we will not have any rates before then. In general, email is going to be better for us to track than voicemail. That way we can see it, we can categorize it, and we can make sure to get back to you. December 15th, we're being told right now, is the last day to change your plan for January 1. And keep that in mind. And with that, we want to say thank you for paying attention. It's a lot of information. We get that. And that's why we made a video so that we could explain everything that we know at this point. So take care, have a good couple of weeks, and we will talk to you soon.
Bye, guys.